Hi there, thanks for being with me right here on the Midday Update, coming to you live at 12 p.m. It's going to be a great edition. We have lots in store for you. Of course, we are looking at what is making headlines and some of the big stories in and around the country. But I will be speaking to two individuals today. First up, to NADIA Abdul Latif, President of the Malaysian Rare Disorder Society. She's also a rare disease advocate. We'll be talking about persons with disabilities, the action plan, as well as the situation for the rare disorders community right here in Malaysia. Also, I speak to Dr. EMMANUEL Benson, Group CEO of EB Holdings, on COVID-19 and the role of private healthcare organizations here in the country as well. Well, first up, as we celebrate, Malaysians celebrate the excellent performance of the country's athletes at the 2020 Tokyo Paralympics, which of course ended yesterday. The Ministry of Youth and Sports is now saying they're looking to take the opportunity to strengthen the plan for persons with disabilities further. We've seen the absolute success, the grit, the dedication, and through sportsmanship of all the Olympians, who of course did so wonderfully well. Now, according to its minister, it's time to amend the Persons with Disabilities Act 2008 to bridge the gap, besides, of course, providing more facilities and access to the group, especially in the wake of the COVID-19 pandemic. It is the global reset, and I guess the silver lining here is that many of pressing issues can be reevaluated and looked at. Now, important services such as welfare assistance, banking, food, and retail should be made fully accessible, primarily through digital services for the disabled to carry out their daily affairs. Now, Senator Dato Ras Adiba she represents persons with disabilities in the Dewan Negara. She had this to say yesterday. She said the government must present evaluations done on the Persons with Disabilities Action Plan. Of course, this we know expires next year, and she advises that the process of drafting a more focused Persons with Disabilities Action Plan 2023-2030 must happen soon. Now, she's added that among this matter is among 16 proposals to the government in efforts to empower the nation's PWD community, that's persons with disabilities community. Ras Adiba, who is also OKU Central President, has proposed that the government expand the PWD category by including rare diseases and albinism, establish a rare diseases trust fund, and provide special allocations through budget 2022. I'd like to bring in now Nadia Abdul Latif, President of the Malaysian Rare Disorder Society, also a rare disease advocate, and my colleague, in fact. I really do miss you. It's been such a long time that we
I
have
miss
spoken
you.
like this. Right. It's good to have you on board, and we couldn't think of anyone better to speak to regarding some of the issues we have at hand here. The PWDs, the action plan, and what is the situation of the rare disorders? Those who are having these conditions right here in Malaysia. Perhaps we can start with this, Nadia. What are some of the challenges at this point that you see with the action plan and beyond that? Or perhaps you could let us in as well to some of the aspects that we do not fully understand or are aware about, Nadia.
Sure. Thank you so much. Now, very often when we talk about OKU and when we talk about rare diseases or rare disorders, whichever the term that you may want to choose, very often the issues are intertwined. But what I think is important to remember is that rare disorders is more than just an issue of OKU or not OKU. The reality of it is there's 7,000 or more than 7,000 rare conditions in the world, and they may be what we call penyakit jarang jumpa in Malaysia, conditions that are not easily found in the critical mass of people in a specific population. However, when you combine those 7,000 conditions, Jessy, you're talking about millions and millions of people all across the world and
Right.
hundreds of thousands across Malaysia. So together we're actually not very rare. So we've been stuck, remember in this conversation we had earlier, on the labels and the semantics, and that has caused us all sorts of issues from the time this was first incepted until now. But having
Right.
said that,
If I
we
could just jump in very quickly,
sure.
why have we come to this point of these labels? I mean, what has caused that confusion, and is there anything being done about that?
Sure. I think by and large, we love labels, right? People need to label something to understand something better. For rare diseases, these labels started up as medical terms so that it assists not only the medical professionals, but also patient action groups and everyone else in the ecosystem to be able to understand what it is that they're trying to assist with. So, for example, just now you mentioned people with albinism. In Malaysia, the situation for people with albinism is very different from, say, for example, Tanzania or in the African continent, where people are massacred and killed just because they look very different. Here in Malaysia, the conditions are perhaps more on stigma, society stigma, to be able to access jobs with dignity, to be able to fully contribute to the economy. So this is some of the issues that we also see for the OKU community, also for the RD community or the rare disorders community. Now, a lot of people don't realize this, but members of the RD community actually contribute to the building of the nation. We have frontliners who are RDs, engineers who are RDs, we've got people who are in government service who are in RDs, but they don't necessarily disclose that they are a person with rare disorder, very often because this comes with a lot of other challenges along with it. Now, if I were to zoom down into what Senator mentioned most recently, and it is most kami sangat mengalu-alukan. We're very happy to see that she's always been a champion for the OKU community. Now she's also a champion for the OKU and the RD community. So indeed, it's definitely, we're honored, and it's a most welcome set of statements that are clear. At least it's a good starting point of some of the things that we need to do in Malaysia. So if I were to zoom down, the first thing she asked was, we need to amend the OKU 2008 Act. I cannot agree more. Right now, if I were to be blunt, the OKU Act very often is seen as a toothless tiger. There's a lot of things that were aspirational, but it never really got to the point where it is things that are implementable for the universal rights and development and well-being of persons with disability, as well as people with rare disorders in Malaysia. So that's point one. Number two, when we were talking about specific to rare disorders, she did highlight that yes, perhaps we can look at meluaskan kategori OKU, or like expand the OKU category to include rare disorders. Now, the reality of it is people with disability in Malaysia, and we're talking about, I think as at 30th June, we're talking about more than 583 or 580 plus thousand OKU registered in Malaysia. But very often this is tied to registration to the Jabatan Kebajikan Masyarakat or the Welfare Department's OKU Act and card, right? It's not the same as the actual number of people who are PWDs in Malaysia. So we know this is actually underrepresented. And so very often when we are looking at the Act, the definition of who qualifies as a person with disability is actually tied to functional disability, which we have all across the OKU community been championing that we should be looking at this more holistically, not just in terms of functional lacking of a specific ability. But you know, that's for a different day. The I think number 8, when she mentioned that we should have a specific allocated fund specifically for tabung amanah. There is a tabung amanah that was actually mooted to be set up, and there has been inroads that the government has made to set up a trust fund for rare disorders in Malaysia. And of course, we're happy to see this. But for the rare disorders community, we also want to see what has happened since then. You've spoken about it. We want to see what we can do together to move this forward. Clearly, COVID-19 has changed the landscape, as you rightly pointed out. So many more issues than when we started off, when this was first mooted prior to the pandemic. So there's a lot of things that we need to be doing more.
To take into account, yeah. Okay, so the PWD 2030 action plan, that aside, what are some of the immediate perhaps solutions that you feel that, you know, it's about time that it must be met or be rolled out? Don't have much time left with you, Nadia, but of course such an interesting topic and one that really needs to be highlighted as well.
I'm glad you mentioned this. Number one, blazing forward. Number one, we need inclusive all-round budgeting for the country 2022 and forward. Let's not leave people behind. Let's really think through what is needed and what needs to be articulated all across the board for OKU, for RD, and everyone else. That's number one. Number two, there was mooted already many years back that we should be setting up an RD policy for the country, and in the runway of setting up a Rare Disorders and Orphan Drugs Act for the country. This, I think, is high time. We've been talking about it for a number of years now. The Malaysian Rare Disorders Society, as well as the whole patient action groups in Malaysia, are looking forward to work together with the government, together with the ministry and everyone else along with it, to be able to ensure that this becomes a reality. Because really, if we build back better as society, we're going to be able to help each other, not just being a cost to the government, which we are not.
Right, that's right. Inclusive, leaving no one behind. These are some of the, I guess, the milestones, that we talk about. But it's time
Yeah.
to really put action behind these suggestions and policies and acts and whatnot. Nadia, thank you for joining us. I know you've got your hands full as well. It's a busy day for you, but we'll speak to you soon. And please do keep, flying the RD flag up high for the rest of us who can't perhaps do enough just yet. We'll speak to you soon. Do take care. That was Nadia Abdul Latif, of course, weighing in on the Persons with Disabilities Action Plan, as well as the situation for the rare community here in Malaysia. Now, as we talk about COVID-19, its impact, a total of 11,000 out of 17,000 new 19 cases were reported yesterday have found to have partial or no COVID-19 vaccination. The health DG says individuals who were partially vaccinated comprise those who had either received only the first dose of the vaccine or both doses, but had not passed the 14th day from the date of the second dose. So a total of 5,000 cases of that number I mentioned earlier were fully vaccinated, with almost 6,000 of them being in category 1, which is, of course, cases that are asymptomatic, and category 2 cases with mild symptoms. So this clearly shows that those who are fully vaccinated are more protected and less at risk of getting severe COVID-19 infection. As we talk about COVID-19 vaccination, private healthcare organizations also are part of this ecosystem. They too play a pivotal role in helping the government. I'd like to bring in now Group CEO of EB Holdings, Dr. EMMANUEL Benson, to tell us a little bit about COVID-19 and the role of private healthcare organizations. Hi, Dato. Thanks for being with us. It's a pleasure speaking to you. Of course, as we talk about private healthcare organizations and their role, where is EB Holdings in the larger scheme of things? And really, at this point of time, how do you view the role of private healthcare organizations, especially as we are in a pandemic right now, the COVID-19 pandemic?
Chopper, Jessy, and thank you very much. Okay. As for EB Holdings, what we are trying to do here, we are trying to bring in the private vaccination program, and we are working together with Dua Pharma, Berhad, and we are bringing in the Sinopharm vaccine, and we want to do the private vaccination program in line with augmentating with the national COVID-19 immunization plan. As you know, private sectors have got a role to play as well in terms of this pandemic and going for this vaccination, and for us to spearhead this vaccination process and for us to achieve the herd immunity. So we believe that we are going to play this role. And as for EB Holdings, we are partnering in Perak with Maju Perak Berhad, and in Johor with J Biotech, and for foreign workers vaccination with Formina. So we believe that, Jessy, that private sectors do need to play a role. As you see the statement by the DG yesterday, that vaccination, it doesn't give you immunity, but it prevents you from getting severe in terms of your COVID symptoms and whatsoever. So vaccination, private vaccination will play a greater role in the future. And I think with the Dua Pharma bringing in Sinopharm, it's a great space for us to providing these services and augmentating the national COVID-19 immunization plan.
That's right. So as the national immunization program is being rolled out, and we've seen that has happened efficiently. It's also happened quite aggressively. So it's reaching out to as many people as possible. But what are some of the other issues that you feel, or you view, that needs to be addressed as we move forward to handle the COVID-19 pandemic, Dato?
I think, Jessy, what we need to be doing is moving up in terms of testing services. As you know, that screening testing is very important. As you know now, there are many new variants that have been detected. And we had the Delta variant, we had the South African variant, we had the Lambada variant, and you have the MU variant. And I hope you're not a Manchester United fan. So
Apparently it's now pronounced Mew, so MU fans
yeah, but
can
because
rest at ease.
being a Liverpool fan, I'll always say it's a MU MU variant. So testing is very important because when you're vaccinated, of course you're not able to cover all these latest variants, and that's why they're looking at even coming up with booster shots and all. But of course, being vaccinated protects you, and testing is very important because when you test, you're able to trace and you're able to isolate. You're not So that is very important, Jessy, because this is what we need to be living. As it's been pointed out by the Honorable Minister, we are going to be moving from a pandemic to an endemic stage. So we have to live with this COVID because in the new norms and wearing a mask and having a frequent COVID testing and all that is going to be a part and parcel of our lives.
That's right. We have to, I guess, to a certain extent, embrace it, to know that this is a phase that may last longer
Yeah.
than we wish. But it's also important that we all have our guard up, and through that, our first suit of armor is, of course, being vaccinated. How does EB Holding intend to move forward right now in terms of its role as a private healthcare organization, Dato? Perhaps what are some of the long-term plans, expansion plans, and new services that you will be bringing to communities?
Oh, okay, Jesse. We have developed our own platform called Track for Me, which is a mobile and an app-based platform. We want to do this as a tracking and monitoring of the pandemic, and also with vaccination program, offering these private vaccination services, as well as for us to do this of post-vaccination monitoring, because we will be doing this lot of antibody testing and checking the levels of immunity, and will be offering telemedicine services, and for us to bring the services to the public and to the industries more efficiently, as well as in terms of analytics for us to track and mitigate the kind of things that's going to cause this pandemic.
Would you say
Because
that this
technology
is
will
one of its kind, that there is no solution like this or platform that exists right now?
Yes, we could say this is one of the kind, and we will say that we are one of the pioneers in terms of implementing this in the market.
Well, thank you very much, Dato, for your time and sharing with us some of the developments and offerings of EB Holdings as a private healthcare organization. We wish you well, and we hope to speak to you soon. And thank you for all the good work that you do in helping people stay healthy. We'll speak to you
Thank you,
soon.
Jesse. Thank you.
Pleasure. That was Dr. Emmanuel Benson, Group CEO of EB Holdings, a private healthcare organization, and playing a pivotal role in helping the government help the people. Now, as we move on, something from the National Recovery Council. Measures to help small traders will be raised and discussed in their next meeting, which will be held soon. The MPN Chairman Tan Sri Muhyiddin told Bernama all matters pertaining to the nation's recovery, taking the whole of society and the whole of government approach, will be discussed. Now, as chairman, Tan Sri Muhyiddin Yassin ensures small traders and sectors will continue to be aided and included in the government's plans to bring the country out of the economic downturn. I think that is an important sentence. We really need to look at the aspects of financially, economically, as well as we try to crawl out of this pandemic. We all have that capability if we stick together and look at our similarities rather than drawing lines of our differences. Well, the High Commission of Malaysia and Singapore is advising Malaysians in the Republic to apply or renew passports at least 6 months before expiry date. They are currently experiencing, they say, a drastic increase in passport applications and even renewals following the implementation of border control measures by Malaysia and Singapore. And this has been happening since April 2020. So Malaysians have also been reminded to book an appointment for any passport application or renewal at the High Commission. Also, if you're dropping by to pick it up, to collect that, please do have an appointment as well. Well, from one issue of healthcare in the country to a word from the Health Minister, Khairi Jamaluddin. He says the number of COVID-19 deaths reported daily does not reflect the actual number of fresh deaths that occur within 24 hours. Now, he explains that the numbers are sometimes piled up over several days as the authorities need time to confirm the cause of death, especially in places like the Klang Valley, which also has a high vaccination rate. And we move towards East Malaysia in Sabah. The federal health minister says priority has to be given to ensure the majority of the state's adult population complete their vaccinations before moving on to the next age demographic group. And so he has added that they are still maintaining the target of 60% of the adult population to be fully vaccinated or immunized by the end of September and 80% by the end of October. Now, Khairi also adds that adolescent vaccination drive will begin with high-risk teenage groups before moving on to the 16 and 17-year-olds. And along with large portion of the nation's workforce working from home since the beginning of the pandemic, the type of properties that buyers are purchasing now also has evolved altogether. This has been reflected in Malaysia's property transaction data from the first quarter of this year, which finds that home buyers are now favoring larger, more spacious units between the prices of 300,000 ringgit to 500,000 ringgit in this range. Now, Property Guru Data Sense Managing Director Joe Hoctor says that many employees can opt for areas further away with lower density and more spacious layouts, which could comfortably fit an extra room for a home office. That's right. That is the new norm, and perhaps some of a silver lining or a positive outcome of us during this global reset. Well, talking about global, let's look at what's happening internationally. Here's a snapshot of international news. Relatives of the 298 victims of Malaysia Airlines Flight 17 earlier this week on Monday accused Russia of lying about its alleged role in the downing of the plane as they begin testifying in the Dutch murder trial of four suspects. International investigations have concluded that the passenger plane was shot down over eastern Ukraine with a missile fired by pro-Russian rebels. Moscow denies any responsibility. And in Cuba, it became the first country in the world to vaccinate children from the age of 2 against COVID-19 using homegrown jabs not recognized by the WHO, the World Health Organization. Having completed clinical trials on minors with its Abdala and Soberana vaccines, Cuba kicked off its inoculation campaign for children on Friday, starting with those 12 and older. And Mullah Neda Muhammad, the Taliban commander, vows to continue fighting against rival jihadists, the Islamic State group. Following the Taliban's victory last month, Muhammad took over as governor of Nangarhar province, home to the IS Afghanistan-Pakistan chapter's stronghold. IS have been responsible for some of the deadliest attacks in Afghanistan of the recent years, massacring civilians at mosques, shrines, public squares, and even hospitals. And the World Health Organization says that hundreds of medical facilities in Afghanistan are at risk of imminent closure because donors who provide the financing are not allowed to deal with the new Taliban government. WHO says that some 90% of 2,300 health facilities across the country are at risk of closure as soon as this week. And aluminium prices rose on Monday after reports of a coup in Guinea triggered concerns that supply of bauxite, the raw material used to make the metal, could be interrupted. Analysts say that Guinea produces about a quarter of the world's bauxite, though there is no sign yet of any supply disruption. And Great Wall Motor will launch an electric compact car and plug-in hybrid SUV in Europe next year, joining a growing number of Chinese car makers trying their luck on the continent with low or zero emission vehicles. The company says that the IAA car show in Munich will start taking orders for the Coffee 01 plug-in SUV for the German market at the end of the year. Looks good. Well, let's move on to what's happening on Twitter. 6 Palestinians have successfully escaped from an Israeli prison after digging a tunnel for nearly a decade. Twitter users are expressing this as the Palestinian version of the Real Prison Break series. I had a quick look at some of the footage available, and it is amazing how that was done. But they are perhaps now also suspecting that there could have been external help. But for more on that, do track Twitter and do check out what's happening over in social media as well. I'm sure a lot of conversation about this. Look, I'm on Twitter as well. My handle at Jessy Chahal. Leave me any comments, any thoughts you'd like to share. Perhaps if you'd like to bring up or tell us about an issue happening here in the country, we'll be more than happy to hear you out. And what else is on Twitter? The Malaysia Day excitement is all over Twitter as well, all in anticipation of good news from the government. Well, fingers crossed, everyone, with the Malaysia Prihatin plan as well. I'll leave you with that. Do remember, if you're not inoculated yet, please get vaccinated, wear a mask, stay home, and stay safe. I'll see you next time. Bye-bye.